Hello, everyone. Thank you for joining us for this month's webinar. The topic is breast cancer awareness, and our presenter is Crystal Henderson. She is our health coach with Orthus Health. Crystal?
Hi. Hello, everyone. Again, my name is Crystal Henderson, and again, we will be discussing breast cancer awareness. Going more into what is breast cancer, the signs and symptoms, risk factors, prevention, and early detection. Let's get started. According to the CDC in 2014, which are the most recent numbers available, over 200,000 women and over 2,000 men in the United States were diagnosed with breast cancer. Of that population, over 40,000 women and over 400 men in the United States actually died from breast cancer. When thinking about what the disease is, it's a disease in which the cells in the breast grow out of control. There are various types of breast cancer, and the kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can actually begin in different parts of the breast. And the breast is made up of three main parts: the lobules, ducts, and connective tissue. The lobules are the glands that produce milk. The ducts are the tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together. Most breast cancers begins in the ducts or the lobules. It can spread outside to the breast through the blood vessels and lymph vessels. And when breast cancer spreads to other parts of the body, it is said to metastasize, and we'll talk more about this later on in the presentation. When thinking about what a normal breast is, it's important to remember that no breast is typical. What's normal for you may not be normal for another woman. Most women say their breasts are lumpy or uneven. The way your breasts look and feel can be affected by beginning your menstrual cycle, having children, losing or gaining weight, taking certain medications. They also tend to change as you age too. Many conditions can cause lumps in the breast, including cancer, but most lumps are caused by other medical conditions. The two most common causes of breast lumps are fibrocystic breast conditions and cysts. So fibrocystic condition causes non-cancerous changes in the breast that can make them feel tender, lumpy, and sore. And cysts are the small fluid-filled sacs that can develop in the breast. Going over a few types of breast cancer, we have non-invasive, invasive, recurrent, and metastatic. So non-invasive cancers stay within the milk ducts or the lobules in the breast. They do not grow or invade normal tissues within or beyond the breast. Non-invasive cancers are sometimes called carcinoma, which mean in the same place, or precancers. Invasive cancers do grow into normal healthy tissues. Most breast cancers are invasive. Recurrent breast cancer is the cancer that has come back in the same or opposite breast or chest wall after a period of time when the cancer couldn't be detected. And metastatic breast cancer is, as I mentioned before, is a breast cancer that has spread to other parts of your body. Both of these are considered advanced stage cancer. Getting into some signs and symptoms, according to the CDC, these are some of the signs: new lump in the breast or underarm or your armpit, any thickening or swelling of part of the breast, irritation or dimpling of the breast skin, flaky skin or redness in the nipple area or the breast. In addition, you have any pain or pulling in the nipple area, nipple discharge other than breast milk, including blood, change in the size or shape of the breast, and pain in any area of the breast. So getting into some risk factors, we'll first start off by talking about some established risk factors, which are the factors that you cannot change. First and foremost, being a woman is the biggest risk factor for developing breast cancer. There are about 100,000 new cases of invasive breast cancer and about 60,000 cases of non-invasive breast cancer this year in American women. As with many other diseases, your risk of breast cancer goes up as you get older. About 2 of 3 invasive breast cancers are found in women 55 or older. Women with close relatives who've been diagnosed with breast cancer and have a higher risk of developing the disease. If you've had, let's say, one first-degree female relative, mother, daughter, sister, diagnosed with breast cancer, your risk is double. And when thinking about genetics, about 5 to 10% of breast cancers are thought to be hereditary, caused by abnormal genes passed from parent to child. When thinking about race and ethnicity, Caucasian women are slightly more likely to develop breast cancer than African American women, Hispanic, and Asian women. But African American women are more likely to develop more aggressive, more advanced stage breast cancer that is diagnosed at a young age. Discussing some other risk factors, being overweight, lack of exercise, smoking, drinking alcohol, and having dense breasts are other risk factors. So overweight and obese women have a higher risk of being diagnosed with breast cancer compared to women who maintain a healthy weight, especially after menopause. Being overweight can also increase the risk of breast cancer coming back or recurrence in women who have had the disease. Research shows a link between exercising regularly at a moderate or intense level for about 4 to 7 hours per week and a lower risk of breast cancer. Smoking causes a number of diseases, and it is linked to a higher risk of breast cancer in younger premenopausal women. Research also shows that there may be a link between a very heavy secondhand smoke exposure and breast cancer risk in postmenopausal women. It's been consistently shown that drinking alcohol beverages such as beer, wine, and liquor increases a woman's risk of hormone receptor positive breast cancer. Lastly, it has been shown that dense breasts can be 6 times more likely to develop cancer and can make it harder for mammograms to detect breast cancer. When thinking about understanding your risk of breast cancer, it's important to understand the relative risk and absolute risk. Knowing that limiting how much alcohol you drink or exercising regularly can decrease your breast cancer is important, but it's also important to understand just how much taking those steps can lower your risk. As I mentioned before, understanding the terms relative and absolute risk can help you better understand your own risk of breast cancer. So when thinking about relative risk, it's the number that tells you how much something you do, such as maintaining a healthy weight, can change your risk compared to your risk if you're very overweight. It can be expressed as a percentage decrease or a percentage increase. Now, absolute risk is the size of your own risk, and it's the reduction. Absolute risk reduction is the number of the percentage points your own risk goes down if you do something protective, such as stop drinking alcohol. The size of your absolute risk reduction depends on your risk to begin with. Now we're going to talk about some ways that you can lower your risk, beginning with nutrition, physical activity, early detection and prevention, and of course, screening and testing. So when thinking about nutrition, we'll go over what does healthy eating mean, understanding food groups and how your body gets nutrients from food, and then also designing a healthy eating plan. Healthy eating means eating a variety of foods that give you the nutrients you need to maintain your health, feel good, and have energy. So these nutrients include protein, carbohydrates, fat, water, vitamins, and minerals. Proteins give your body amino acids, the building blocks that help keep your body's cells and do all their everyday activities. So protein also helps your body build new cells, repairs old cells. It creates hormones and enzymes, and it keeps your immune system healthy. For instance, if you don't have enough protein, your body can take longer to recover from an illness, or it can make you more susceptible to getting ill. Carbohydrates give you quick energy. They quickly go through your blood as glucose or blood sugar, which your body uses for fuel first before turning whatever's left over into fat. Fruits, vegetables, bread, pasta, cereal products, grains, dried beans, peas, and lentils are all good sources of carbohydrates. And many of them are also good sources of fiber, which helps keep your digestive system healthy. When talking about fats, they give your body the fatty acids it needs to grow and produce new cells and hormones. Fat also helps vitamins move through your body. So vitamins A, D, and E, and K are all fat soluble, which means they need some fat to be absorbed. They are also absorbed in the fatty tissues in your body and the liver. Fat also helps protect your organs against trauma. Your body stores excess calories as fat, which is saved up as reserve energy. When talking about vitamins, they keep your bones strong, your vision clear and sharp, and your skin, nails, and your hair healthy and, of course, glowing. Vitamins also help your body use energy from the food you eat. When thinking about minerals, minerals are the chemical elements that help regulate your body's processes. Potassium, for example, helps keep your nerves and oxygen function in muscles. Calcium helps your teeth and bones stay strong, and iron carries oxygen to your cells. Water, of course, is necessary for life, which makes it vital for good health. It makes up about 50 to 60% of your total body weight, regulates your temperature, moves nutrients through your body, and gets rid of waste. In general, it's a good idea to drink about 6 to 8 glasses of water a day. Now, when thinking about designing a healthy eating plan, it's important to design a plan that meets your individual goals. Using tools such as a food tracker can help you further analyze what you eat. It's best to choose the most nutrient-dense foods you can get from each food group a day. Those that are packed with vitamins, minerals, fiber, and other nutrients, and are also low in refined carbohydrates such as sugar and white flour. Pick foods like vegetables, whole grains, fruit, and lean meat and fish. The United States Department of Agriculture 2015 to 2020 Dietary Guidelines for Americans recommends getting less than 10% of calories per day from added sugars, less than 10% of calories per day from saturated fats, and eating less than 2,300 milligrams per day of salt. Physical activity is another way to lower your risk. Exercising regularly is an important part of being as healthy as you can be. A lot of research is showing that exercise can reduce the risk of breast cancer coming back if you've been diagnosed, as well as reducing the risk of developing breast cancer if you've never been diagnosed. Not only can exercise help lower your risk of breast cancer coming back and maintain a healthy weight, as well as be a preventative measure, it also can help ease any treatment side effects, boost your energy, and just promote overall health. Although breast cancer is not preventable, you can lower your risk and take the necessary precautions with screenings. And when considering women with average risk versus high risk, the screening guidelines can vary. A woman at average risk doesn't have a personal history of breast cancer, a strong family history of breast cancer, or a genetic mutation known to increase the risk of cancer, such as the BRCA gene, and has not had a chest radiation therapy before the age of 30. So with that, women between 40 and 44 have the option to start screening with a mammogram every year. Women ages 45 to 54 should get mammograms every year. Women 55 and older can switch to mammogram every other year, or they can choose to continue yearly mammograms. Screening should continue as long as a woman is in good health and is expected to live 10 more years or longer. When thinking about women at high risk, women at high risk should begin with a screening with an MRI and mammograms when they're 30 and continue for as long as they are in good health. A woman at high risk should make the decision to start with her healthcare providers, taking into account any personal circumstances, preferences, and any additional family history. Okay, getting into some screening and testing. Now, regular mammograms can help find breast cancer at an early stage when treatment is most successful. A mammogram can find breast changes that could be cancers before physical symptoms develop. Results from many of the decades of research show that women who have had irregular mammograms are more likely to have a breast cancer found early, and they are also less likely to need aggressive treatment, such as surgery um, and chemo too. They're most likely to be cured. Now, if an MRI is used, it should be used in addition to, not instead of a screening of a mammogram. This is because although an MRI is more likely to detect cancer than a mammogram, it still may miss some cancers that a mammogram would detect. So it's just important to just include both. Now, when thinking about self-exams, research has not shown a clear benefit of physical breast exams done by either a health professional or by yourself for breast cancer screening. There's very little evidence that these tests help find breast cancer early when women also get screening mammograms. So because of this, a regular clinical breast exam and a breast self-exam are not recommended as the only basis of testing. They should be used, however, to monitor any changes in your breast and, of course, report those changes to your healthcare professional. When thinking about genetic testing, it's also a method used to detect the risk of breast cancer. A genetic test involves giving a blood or saliva sample that can be analyzed to pick up any abnormalities in these genes. The most well-known genes that can mutate and raise the risk of breast cancer are the BRCA1 and BRCA2, which we'll talk about. Women who inherit a mutation or abnormal change in any of those genes from either their mothers or fathers have a much higher than average risk of developing breast cancer. Men with these mutations have an increase of breast cancer, especially if the BRCA2 gene is affected. The function of the BRCA gene is to keep the breast cells growing normally and prevent any cancer growth. But when these genes contain the mutations, they are passed from generation to generation. They do not function normally, and the breast cancer increases, the breast cancer risk, I should say. So, of course, talk to your doctor about any screening options that you feel comfortable with and that are based off of your personal circumstances, family history, and personal preference as well. Thank you for joining this month's webinar. As always, your health coach is available to assist you with any health goals you wish to work on for yourself, including those that may reduce your risk. And thank you again, and have a great day.